Hello and welcome. I am Sri. You are watching Capsa, your go-to channel for pharmacy and biomedical science tutorials. Today we will be discussing a very important topic, cystic fibrosis. In this video, we will explore everything from its causes and symptoms to the latest treatments and lifestyle tips. Whether you are here to learn more about this condition or to support a loved one, I hope you found this information helpful and easy to understand. So let's dive right in. Cystic fibrosis or CF is a chronic inherited genetic disorder that primarily affects the lungs and digestive system. It is caused by mutations in the CFTR gene. The condition is relatively rare, impacting around 70,000 people worldwide, with approximately 30,000 cases in the United States. CF is most commonly diagnosed in children as symptoms typically appears early in life. However, some adults may also be diagnosed later on if they show symptoms that were not recognized in the childhood. Importantly, cystic fibrosis affects both men and women equally, with no significant gender bias in its prevalence. Now let's discuss the causes and pathophysiology of cystic fibrosis. Cystic fibrosis is caused primarily by genetic mutations in the CFTR gene, which leads to a production of a faulty protein. This protein plays a vital role in the transport of chloride ions and water across the cell membrane. When it malfunctions, it results in the production of thick and sticky mucus that can obstruct various organs, particularly the lungs and pancreas. The disease is inherited in an autosomal recessive pattern, meaning both parents must pass on defective gene for a child to be affected. This genetic background leads to a significant complications such as chronic lung infections due to mucus buildup and impaired digestion from pancreatic obstruction. Understanding these causes is crucial for comprehending the challenges faced by individuals with cystic fibrosis. Now let's delve into the symptoms that characterize the conditions. Cystic fibrosis presents with diverse range of symptoms that primarily affect the lungs and digestive system. One of the hallmark symptom is persistent cough that often produces thick sticky mucus. This mucus can obstruct the airways, leading to frequent lung infections including pneumonia and bronchitis. Patients may also experience wheezing and shortness of breath, especially during physical activity. On the digestive side, many individuals with CF struggle to gain weight despite having a good appetite. This is due to pancreas not producing enough enzymes to digest food properly. As a result, you may notice frequent greasy stools that are indicative of poor nutrient absorption. In some cases, intestinal blockages can occur, particularly in newborns. Another notable symptoms of cystic fibrosis is the characteristic salty skin. When you hug or kiss someone with CF, you might notice their skin is taste so much salty. Other symptoms include the development of nasal polyps, which can lead to sinus infections, and clubbing of fingers or toes which occurs due to low oxygen levels in the blood. It's important to recognize these symptoms early, as early diagnosis and intervention can significantly impact management and quality of life for those affected by cystic fibrosis. Now we have established the importance of recognizing cystic fibrosis early. Let's dive into the specific early signs of cystic fibrosis in children. First one is the most concerning indicator is growth delays. Children with cystic fibrosis may struggle with poor weight gain even when they have a good appetite. This can be particularly alarming for parents as it often stems from malabsorption of nutrients due to pancreatic issues. Next, we need to consider the respiratory issues. A persistent thick cough is a hallmark sign of CF, often accompanied by frequent lung infections. The buildup of thick mucus in the lungs creates an environment ripe for bacterial growth, leading to a recurrent respiratory infections that can affect overall health. Moving on the digestive symptoms, many children with CF experience greasy stools and bloating. This is due to body's inability to absorb fats and proteins effectively, which can lead to discomfort and nutritional deficiencies. Another important sign is salty skin. Many parents notice in is notably salty taste when they kiss or hug their children. This is due to an imbalance of salt transport in the body, which can be a direct result of defective CFTR protein. Furthermore, nasal problems such as chronic congestions and sinus infections are also common in CF. The thick mucus can obstruct the nasal passages, making it difficult for children to breathe through their nose comfortably. Lastly, we have to talk about low energy. Children with cystic fibrosis often experiences increased fatigue compared to their peers. This can affect their ability to participate in activities and enjoy their childhood fully. Recognizing these signs is vital for early diagnosis and interventions. If you notice any of these symptoms, it's essential or crucial to consult a healthcare provider for further evaluation. In summary, being vigilant about these early signs can lead to timely medical care, significantly improving the quality of life for children with cystic fibrosis. In this segment, we will explore how cystic fibrosis impacts lung health, focusing on the mechanisms that can lead to coughing and lung diseases. Let's start with the thick mucus production. In cystic fibrosis, the malfunctioning CFTR protein causes the mucus in the lungs to become extensively or excessively thick and sticky. This thick mucus obstructs the airways, making it incredibly difficult for the lungs to clear out debris and pathogens. As a result, patients often face severe respiratory complications. Next, we have airway obstruction. The accumulation of this thick mucus can lead to blockage in the airways, significantly reducing airflow. This obstruction traps bacteria, creating an environment where they can thrive, which impairs respiratory function even further. This brings us to chronic infections. The stagnant mucus is a breeding ground for harmful bacteria such as Pseudomonas aeruginosa, Staphylococcus aureus, etc. These infections can become recurrent, leading to progressive lung damage and worsening the patient's overall health. The body responds to these persistent infections with inflammation. The immune response can cause significant inflammation in the airways, which may damage lung tissues over time. In severe cases, this chronic inflammation can result in bronchiectasis, where the bronchi become permanently dilated and lose their ability to clear mucus effectively. Now let's discuss impaired lung function. Lung function is typically measured using forced expiratory volume in 1 second, or FEV1. A significant decline in FEV1 indicates deteriorating lung health, reflecting the ongoing progression of cystic fibrosis. Finally, coughing plays a crucial role in the lives of cystic fibrosis patients. While coughing is a reflexive action aimed at expelling mucus and maintaining airway clearance, it can become more frequent and severe as the disease advances. This increase in coughing not only disrupts daily life but also leads to increased fatigue and diminished quality of life. Understanding these mechanisms helps us appreciate the complexity of cystic fibrosis and the profound impact it has on lung health. We will explore implications of a late diagnosis of cystic fibrosis and how it can significantly impact patients' life. First and foremost, worsening health outcomes are the major concern. Patients diagnosed later often experiences more severe symptoms due to prolonged lung damage, including chronic coughing, difficulty breathing. This leads to a decreased lung function, which can ultimately result in complications like respiratory failure requiring more aggressive interventions. Next, let's consider delayed treatment. When cystic fibrosis is diagnosed late, patients miss out on timely interventions that could substantially improve their health outcomes. They may not receive access to crucial treatments such as enzyme replacement or nutritional counseling in timely manner, significantly impacting their ability to manage symptoms effectively. As we move on, we need to discuss the increased risk of complications. A late diagnosis heightens the likelihood of encouraging serious issues such as recurrent respiratory infections that damage lung tissues over time. Patients are also at risk for developing diabetes and liver diseases, requiring additional medical management and complicating overall treatment plans. Now, let's talk about the psychological impact. Both parents and their children's, the patients and their families may face emotional challenges, including anxiety, depression, as they navigate the realities of living with a chronic illness. The necessity for lifestyle management or adjustment can also lead to feeling of isolation, impacting social interactions and support systems. Educational and social challenges also arise for children diagnosed late. They may experience academic struggles due to frequent absences of medical appointments and illnesses, making it harder to keep up with their peers. This can lead to difficulties in navigating social relationships as they might feel different from their classmates. Finally, we cannot ignore the financial burden that comes with a late diagnosis. Increased healthcare costs due to more intensive treatments and hospitalizations can be overwhelming for families. Additionally, parents may also experience lost income from taking time off work to provide care and further straining their financial stabilities. First, let's talk about CFTR modulators. These medications are game changers for many patients. For instance, ivacaftor enhances chloride transport for specific genetic mutations, leading to improved lung functions. Lumacaftor or ivacaftor works by improving protein folding and functions, while ivacaftor targets multiple mutations effectively. The latest addition, alexacaftor, tezacaftor, ivacaftor combination or tricaftor, has shown remarkable improvement in the lung function for a broad patient population. Next, we have inhaled therapies, mucolytics like Dornase alpha, thin mucus, making it easier to clear from the lungs. Additionally, hypertonic saline helps hydrate airways and bronchodilators relax airway muscle, enhancing airflow. Antibiotics play a crucial role in managing chronic lung infections common in cystic fibrosis. Long term antibiotics such as aztreonam are essential for controlling infections, particularly those caused by Pseudomonas aeruginosa. Both oral and inhaled antibiotics are tailored to target these specific bacteria effectively. Nutritional support is another crucial or critical aspect of treatment for patients with pancreatic insufficiency. Pancreatic enzyme supplements help aid digestion. A high calorie diet is also recommended to support growth and maintain body weight. For patients with end age disease, lung transplantation can significantly improve the quality of life. It's a serious consideration for those facing severe lung complications. Lastly, let's touch on gene therapy advances. Ongoing research is focused on correcting the underlying genetic defects associated with cystic fibrosis. Innovative approaches leading to CRISPR and gene editing technologies hold potential for future treatments. We will explore importance of genetic testing for cystic fibrosis, highlighting how its benefits for patients and their families. First, let's discuss early diagnosis. Genetic testing can identify cystic fibrosis in newborns even before any symptoms appear. This early detection allows for timely interventions and better management of symptoms, ultimately reducing complications and improving health outcomes. Next, we have the carrier testing. The testing is crucial for family planning. It determines whether individuals carry the CFTR gene mutation. For couples considering children, this information is vital for making informed reproductive choices. Understanding your career status can help guide decisions about family planning and genetic counseling. Moving on to personalized treatment plans, knowing the specific mutations present patient's in a patient allows healthcare provider to tailor treatment plans accordingly. For instance, identifying mutations can lead to the use of targeted therapies such as CFTR modulators. This personalized approach can significantly enhance treatment outcomes and improve the quality of life for individuals with cystic fibrosis. Additionally, genetic testing plays a role in assessment. It helps families understand their risk of having another child with cystic fibrosis, which can be emotionally impactful. Having this information allows families to seek psychological support and make informed decisions. Finally, genetic testing contributes to ongoing research and advances in cystic fibrosis care. The data collected from genetic testing helps researchers develop better treatments and potential cures. Moreover, it enables the identification of eligible participants for clinical trial based on specific genetic profiles. First, let's talk about nutrition and diet. A high calorie, nutrition rich diet is essential for individuals with cystic fibrosis. Focus on healthy fats, proteins, and complex carbohydrates. Eating smaller, frequent meals can also aid digestion and help maintain weight, which is crucial for overall health. Next is hydration. Staying well hydrated is vital. Drinking plenty of fluids helps thin mucus, making it easier to clear from lungs. Additionally, consider incorporating electrolyte drinks, especially in hot weather or after exercise, to maintain electrolyte balance. Regular physical activity is another key component. Engaging in aerobic activities such as swimming or biking and can significantly improve lung function and overall fitness. Additionally, practicing breathing exercises like pursed lip breathing can enhances lung capacity and efficiency. Airway clearance techniques are also beneficial. Chest physiotherapy, whether through manual techniques or devices like flutter valves, can help loosen mucus in the lungs. Postural drainage using specific positions during the breathing exercises can also aid in clearing mucus. Now let's touch on herbal remedies. Incorporating anti-inflammatory herbs like turmeric and ginger into your diet may help reduce lung inflammations. Additionally, antioxidant rich foods such as berries, leafy greens, and nuts support overall health and may help mitigate some symptoms. Lastly, stress management is crucial for overall well being. Mindfulness and relaxation techniques such as yoga, meditation can help reduce stress levels. Moreover, connecting with support groups can provide emotional support and help individuals cope with the challenges of living with cystic fibrosis. Now let's talk about the topic that's crucial for managing this condition, nutrition. Where what we need to eat really to make the difference in how we feel and how our bodies functions. Let's kick things off with the foods you should be embarrassing. We are talking about high calorie powerhouses. foods rich in calories can help maintain energy levels and support your body. Think avocados. They are not just trendy, they are packed with healthy fats. Then we have nut butters, almond, peanut, you name it. They are delicious way to add proteins and calories to your meals. Next up, protein-rich foods are your best friends. Lean meats like chicken and turkey are fantastic, as is fatty fish, which provide essential nutrients. And don't forget about dairies like cheese, yogurt, and milk can pack a protein punch and offer calcium too. Now let's not skip the whole grains. Foods like quinoa and brown rice are excellent sources of complex carbohydrates, providing you with sustainable energy throughout the day. And if you love bread, go for whole grain varieties to boost your fiber intake. Fruits and veggies are essential too. Load up on berries and leafy greens for a burst of antioxidant and vitamins. And let's not overlook bananas and sweet potatoes. Both are great sources of potassium that your body craves. Hydration is equally important. Make sure you are drinking plenty of fluids. Electrolyte drinks can be particularly helpful, specifically in warmer weather or after a workout. Now, let's talk about what to avoid. Processed foods are a no go. They might be convenient, but sugary snacks and fast food often lack nutrients and can lead to weight gain without any benefits. And watch out for low fiber foods like white bread and pastries. This can lead to digestive issues. Sometimes no one wants to deal with. Sodium is another thing to monitor. High sodium foods like canned goods and salty snacks can worsen dehydration, which is common concern in cystic fibrosis. Also, let's ditch the trans fats. Foods like fried snacks and certain margarine can lead to inflammation and heart problems. Definitely not what you want. And lastly, let's talk about sugar. While it's tempting to indulge, excessive sugar from sodas and sweets can cause energy crashes and really does not contribute to your overall health being. Let's focus on something incredibly important: lifestyle and care tips that can enhance your quality of life. Whether you are living with cystic fibrosis or supporting someone who is, these tips for you. First up, let's talk about regular exercises. Engaging in physical activity can do wonders for your lung function and overall health. Think about incorporating aerobic activities like swimming or walking into your routine. They are not only fun but can also help improve your stamina. And don't forget strength training. Building muscles can enhance your body's efficiency and support your daily activities. Next, hydration is the key. Drinking plenty of fluids is crucial for thinning mucus, making it easier to clean from your lungs. Aim for at least 8 to 10 cups of fluid a day. And don't hesitate to include electrolyte drinks, especially after workouts or during hot weather. Now let's discuss airway clearance techniques. These methods like chest physiotherapy or using devices like such as PEP mask play a vital role in keeping your airways clear and preventing infections. Incorporating these techniques into your daily routine can significantly improve lung functions over time. Nutrition management is another important aspect. A high calorie, high protein diet is essential for maintaining energy levels and supporting growth and repair. If you struggle with digestion, consider pancreatic enzyme supplements to help your body absorb nutrients more effectively. Regular medical checkups are crucial too. By visiting your healthcare provider at least every 3 months, you ensure early detection and management of any complications. This proactive approach can make all the differences in your health journey. Let's not forget stress management. Living with cystic fibrosis can be overwhelming at times, so finding effective ways to manage stress is vital. Techniques such as mindfulness, meditation, or yoga can help you relax and enhance your overall well being. Social support also plays a significant role in managing cystic fibrosis. Connecting with family, friends, and support groups can provide emotional support and shared experience. Remember, you are not alone on this journey. Lastly, educate yourself. Understanding your condition and staying informed about treatment options can empower you. Use reliable source and don't hesitate to attend workshops or webinars to expand your knowledge. Thank you for joining me in this comprehensive exploration of cystic fibrosis. We have covered a range of important topics from understanding the definition and the prevalence of this condition to discussing innovative therapies and lifestyle tips that can significantly enhance the lives of those affected. As we have seen, cystic fibrosis is not just a single disease, it's a multifaceted condition requiring a tailored approach to treatment and care. The advances or advancements in therapies like CFTR modulators and gene therapy are truly remarkable, offering hope and improved outcomes for many individuals. Let's continue to raise awareness and support ongoing research that can lead to even better treatment and ultimately a cure for cystic fibrosis. If you found this information helpful, please like, share, and subscribe for more in depth discussion on medical topics. Together, we can foster a better understanding of cystic fibrosis and contribute to well being of those living with these conditions. Thank you.